Hello, people, and welcome to Med Novice, where we make tough medical stuff make sense. So, today's topic of discussion is cellular injury. Last time we discussed about the growth adaptations. Now, if the stress exceeds the cell's ability to adapt, that causes an injury, right? And likelihood of injury mainly depends on three things. We are talking about likelihood of injury, right? It depends on mainly three things, that is type of stress, first one, by which I mean that let's say inflammation will most likely result in adaptation rather than injury, right? So that is what we mean by the type of stress. Second thing is severity of the stress, right? For example, you can say that in case of a low grade chronic stress, adaptation is more likely, while in case of high grade acute stress, injury is more likely to occur, right? And the third thing on which the likelihood of injury depends is the type of cell, right? So whatever factor is causing the injury, irrespective of that, what we need to see is that the type of cell which is under consideration, how much sensitive it is to that factor. For example, hypoxia can cause injury, right? So hypoxia in case of neurons is more likely to cause an injury because neurons are the most sensitive ones to hypoxia, right? So this way, type of cell is something which likelihood of injury depends on, right? Now we will be seeing what are the common causes of injury. So one basic thing what we saw is that whenever stress exceeds the cell's ability to adapt, whenever cell's ability to adapt is exceeded by the stress, it is likely that injury will occur, right? Now coming to the common causes of injury, what can they be? The common causes are, first one is inflammation. The second one is nutritional deficiency or excess, right? Nutritional deficiency or excess. The third thing, which will be the main focus of our discussion, which can cause injury, cell injury, is hypoxia. The most common cause of cell injury, that is hypoxia, right? What can be the other reasons? It can be due to trauma, right, where you can see mechanical stress resulting in cell injury, and the final one being genetic mutations. So these are the main 5 causes which can result into cell injury. Now coming to our main discussion, that is hypoxia, right? We will be mainly discussing hypoxia in this lecture. So what exactly hypoxia is? Hypoxia is basically low oxygen delivery. Sorry with that. So what hypoxia exactly is? It is low oxygen delivery to the tissues, right? Now if there will be low oxygen delivery to tissues, we know that in the electron transport chain, the final electron acceptor is oxygen, which when accepts electron results in ATP formation, right? So we don't have the terminal electron acceptor of ATC, hence there will be reduced formation of ATP, right? Now if there will be reduced formation of ATP, it would affect all the functions going on in the cell which require ATP, right? So as those vital functions will be affected, it can result in cell injury. So this is how hypoxia works, right? What can be the causes of hypoxia now? So coming to the causes of hypoxia, you want to deliver low oxygen to tissues. So one thing is that you can say that the blood flow through the organ is reduced, which means the first cause is ischemia. What can be the second cause? That the blood has low partial pressure of oxygen in it, or you can say basically hypoxemia, right? And coming to the third cause of hypoxia, if the oxygen carrying capacity of the blood is reduced, right? Who is the main guy who is carrying oxygen in blood? It's hemoglobin. So any issue with the hemoglobin can lead to decreased oxygen carrying capacity of blood, and due to which even if there is normal blood flow to the organ, you can see that hypoxia is there as the oxygen carrying capacity is low, so the delivery of oxygen to the tissues will be low. So this is how low oxygen carrying capacity can cause hypoxia. Of these, the most common cause is ischemia, right? Now coming to our topic, ischemia, we will discuss these causes one by one, right? So coming to ischemia, ischemia is basically reduced blood flow through an organ, right? So let's say this is your organ, right? Let's say this is your organ, and here comes the artery coming with some blood to the organ, and here is a vein exiting the organ with some blood, right? So this is the vein, this is the artery. Now you want to reduce the blood flow through organ. So what are the ways that you can reduce blood flow through this organ is, first you can see that if there is obstruction of the artery, right? If there is obstruction of artery, which can be caused due to atherosclerosis, for example in case of coronary artery, leading to angina, which is episodic chest pain, right? So if there is obstruction of the artery, then the blood flow will be obstructed, and obviously the blood flow will be hence reduced, right? Second case, if your vein is obstructed, right? So if vein is obstructed, it will sort of cause the stasis of blood behind it, right? Behind the point of obstruction, due to which what you will see is that the fresh blood flow to the organ will be blocked, as there will be stasis of blood in the organ, right? One common example, one famous example, where you can see this obstruction of vein is Budd-Chiari syndrome, in which you see thrombosis of the hepatic vein, right? So Budd-Chiari syndrome is one famous example of obstruction of vein, where the hepatic vein is obstructed due to thrombosis, right? Now what can be the common cause of that thrombosis? So for that you need to understand that if RBC increases in blood, right? If the RBC mass increases too much in the blood, that will lead to increased density and viscosity of the blood, due to which this obstruction can occur, right? The flow won't be laminar then in that case, right? As the viscosity has increased. So what can be the causes for increasing RBC in blood? So it can be due to polycythemia vera. Other cause for this thrombosis can be lupus, right? So these were the two ways you obstructed blood flow to the organ, or obstructed the blood exit from the organ, right? There can be a third case causing ischemia, where you will see general reduced perfusion of blood throughout the entire body, due to which you will also see that there is reduced blood flow through the organ. You can see that, and that is shock, right? So these were the three ways ischemia can occur, and ischemia is the major cause, the main cause of hypoxia, right? Now coming to the second cause of hypoxia, that is hypoxemia, right? So to understand hypoxemia, let's understand the general paradigm. Now what you need to understand here is that oxygen is present in atmosphere. When you inhale, oxygen enters your airways. It ultimately reaches the alveoli. From alveoli, it reaches the arterioles, and from the arterioles, basically through the capillaries, it reaches the arterioles, right? From arterioles, it goes to basically inside the RBC. Some remains in the blood plasma, and some of the oxygen enters the RBC, and then it attaches to hemoglobin, and this way the entire paradigm works, right? Now what is the driving force in each of these steps? You can say that partial pressure is the driving force, due to which oxygen is squeezing from one level to the another, right? So FiO2, let's say FiO2, this is the fraction of oxygen in atmosphere, and hence you can say it will ultimately correlate to the partial pressure of oxygen in ATM, in atmosphere basically. So FiO2 is the driving force to squeeze in oxygen from atmosphere to our airways, right? Now oxygen has entered the airways, it has reached alveoli. Now the partial pressure of oxygen in alveoli, this is the driving force to squeeze in oxygen from the alveoli to capillaries to arterioles, right? So now oxygen has reached arterioles. Let's say the pressure in arterioles of oxygen is, partial pressure of oxygen in arterioles is P small ao2. This is at the level of alveoli and this is at the level of arteriole, right? Now this P small ao2 will act as the driving force to squeeze in oxygen and help it cross the RBC membrane, right? And as it will cross the RBC membrane, it will finally go to attach with hemoglobin, and hemoglobin molecules will get saturated with oxygen. To quantify the quantity which we will be using is SaO2, right? SaO2. So this is the saturation, right? So this is one important paradigm. It helps to understand many concepts. Now coming to this paradigm, so if I reduce the FiO2, the driving force is reduced for oxygen to enter into the alveoli. So ultimately it will result in a decreased PaO2, right? If oxygen in the alveoli is less, the partial pressure of oxygen in the alveoli is less, there is less driving force to squeeze it into the arterioles. So ultimately it will result in a reduced arteriolar partial pressure of oxygen. And saturation is something which won't directly be affected always, as saturation may be normal, as it depends on the affinity between oxygen and hemoglobin, right? So we will see that in further our discussion. So coming to the first case, right, where hypoxemia might occur, is if you are present at high altitude, right? If you are present at high altitude, what you will see is FiO2 reduces, and following this paradigm, the arteriolar partial pressure of oxygen will reduce, right? So this is how you cause hypoxemia in the blood. Okay. Coming to the second example, what can happen is that let's say due to hypoventilation or due to COPD, in which you see air is trapped in lung, the partial pressure of CO2 in the alveoli increases, right? Now if partial pressure of CO2 in the alveoli increases, it will ultimately result in a reduced partial pressure of oxygen in the alveoli. Okay, we are clear till here. And again, this will lead to your reduced partial pressure of oxygen in the arterioles. Now other way to reduce the partial pressure of oxygen in the alveoli is interstitial fibrosis. You can see it in case of interstitial fibrosis, right? In which what happens basically is the alveolar wall thickens, right? So these are the two examples in which you can see that in one case the FiO2 has reduced in case of high altitude, due to which the arteriolar partial pressure of oxygen reduces, which means you have resulted ultimately into an hypoxemia. And the second case we saw that the partial pressure of CO2 in alveoli increased. It can be due to hypoventilation and COPD, right? So these are the two causes due to which the alveolar partial pressure of oxygen reduced, and it can also reduce due to interstitial fibrosis, and ultimately resulting in a low arteriolar partial pressure of oxygen, which means hypoxemia has happened, right? Discussing in basic terms what exactly hypoxemia was, that if in the arteriole your partial pressure of oxygen is less than 60 mm of Hg, right? So that is your hypoxemia, right? You can define it generally like this. Okay. Now if the hypoxemia is severe, it can also result into the saturation of oxygen going down, right? Less than 90%. So this was hypoxemia, guys. This paradigm is quite important to understand the concept, and it basically simplifies the concept for you. Now coming to the third factor for hypoxia, which was reduced oxygen carrying capacity. Right. So who will be the main culprit here? It will be hemoglobin. Now oxygen carrying capacity we are discussing in terms of blood mainly, right? Of the blood as a whole, we are saying if the oxygen carrying capacity reduces, in that case there will be hypoxia, right? So how can oxygen carrying capacity of blood reduce? The guy who is carrying oxygen in blood, that is hemoglobin, either you lose it or there is dysfunction of hemoglobin, right? Either you lose hemoglobin or there is dysfunction of hemoglobin. Now losing hemoglobin, what comes to your mind is anemia. What exactly anemia is? Reduced RBC mass, right? So RBC mass is reduced, but the partial pressure of oxygen in arterioles, has that been affected? No, because the squeezing of partial pressure of oxygen is mainly due to the gaseous form, right? And the gaseous form has not been affected anywhere if you are reducing the RBC mass. What is being affected is the oxygen which is being bound to your hemoglobin, right? As there is less amount of hemoglobin, less amount of oxygen is overall binding in the blood to the hemoglobin, right? So there is nothing to do with the partial pressure of oxygen in arteriole here. So what you will see is that PaO2 is normal. Second thing, will the saturation of oxygen get affected? The answer is no, because hemoglobin as a molecule still is binding to 4 molecules of oxygen. The problem here is the amount of hemoglobin is low, right? The problem is not with the functioning of hemoglobin, it is with the amount of hemoglobin. So again, your saturation of oxygen will be normal, right? Now coming to hemoglobin dysfunction. So the first case what we can discuss here is CO poisoning, carbon monoxide poisoning. Now what's interesting is that carbon monoxide is a molecule that has a very higher affinity towards hemoglobin as compared to oxygen, right? So if there is exposure to large amounts of carbon monoxide, so that can result into more amount of carbon monoxide binding to hemoglobin, due to which the site for binding of oxygen will be reduced, right? As the site of oxygen binding is reduced, there will be low binding of oxygen with hemoglobin. As there will be low binding of oxygen with hemoglobin, what you can say is the saturation of oxygen has reduced. The saturation of oxygen has reduced. But has the gaseous form that is present in the blood been affected? No, that has not been affected. Hence what you will see here is that the arteriolar partial pressure of oxygen is normal, but the saturation of oxygen has decreased, right? Now from where you can get exposure to CO? You can get exposure to CO from smoke, right? Smoke resulting from fires or exhaust from cars or gas heaters. For CO poisoning, the most commonly what you see is gas heaters, right? It is suggested that when you sleep, then you should not leave the gas heaters on throughout the night, right? It can release large amounts of CO, which will ultimately result in CO poisoning. Now, what is the clinical presentation? The earliest sign what you see here is headache, right? The early sign what you see here is headache. And second thing what you can see here is the characteristic cherry red appearance of skin. Cherry red appearance of skin. Okay. And if there is significant exposure, it can also result in coma and death. And hence CO poisoning was a case where you can see hemoglobin dysfunction, right? Other case what you can see is of methemoglobinemia. Okay. So now we will be discussing methemoglobinemia. What happens here basically is that under normal circumstances, in a normal hemoglobin molecule, in the heme portion, the central metal atom, iron, is in a +2 state, right? But due to some oxidant stress, this converts into Fe+3 state, due to which the capacity, the capability of oxygen to bind to the entire hemoglobin molecule gets reduced, right? Due to which what you see is O2 can't bind. This was due to oxidant stress, and the molecule under consideration here is heme, a part of hemoglobin, right? So Fe+2 was normal in heme, but due to oxidant stress, it converts into Fe+3, right? Due to which oxygen cannot bind to the hemoglobin. So this is one proper hemoglobin dysfunction, you can say. What can be the oxidant stress, right? Let's see. The oxidant stress can be due to drugs. For example, if someone is on sulfa drugs, or you can say nitrate drugs, right? In that case, you can see there is an increased oxidant stress, due to which this dysfunction can occur. Other cases you can see in newborns. Now this is something very interesting, right? So what happens is, we know that under normal circumstances oxygen is flowing in our blood, right? So some basic amount of oxidant stress is already present in blood. Okay, some basic amount of oxidant stress is already present in blood, due to which we all have some amount of methemoglobin in our blood. But in us, in adults, there are enzyme machineries to convert this Fe+3 back to Fe+2, right? To reduce the oxidized iron central atom back to its normal state, due to which the hemoglobin can function properly now. But in case of newborns, these enzyme machineries are not that mature, right? These enzyme machineries are immature in newborns, due to which you can see methemoglobinemia happening in newborns, right? They are prone to it. Okay. Now what is the presentation? The presentation is cyanosis, and one characteristic is that the blood will be of chocolate color, right? So you will see chocolate colored blood. Now if you want to treat methemoglobinemia, what you will do basically is that iron was oxidized. So now either the machinery is immature, or the machinery is incapable of performing its function, right? Of reducing the Fe+3 back to Fe+2. So what you need to do is you need to give some reducing agent which will convert that Fe+3 back to Fe+2. Hence the treatment is IV methylene blue. So the treatment is IV methylene blue. Okay. Clear till here? So now these were the causes we discussed for hypoxia, right? We discussed about ischemia first of all. Ischemia was the most common cause. After that, we discussed that ischemia can be caused due to three reasons. One can be the obstruction of artery, one can be the obstruction of vein, and the third one can be generalized reduced perfusion, which is shock, right? The second cause for hypoxia was hypoxemia, right? In hypoxemia, what was happening is that your partial pressure of oxygen in the arterioles was reducing, and it was going less than 60 mm of Hg, right? And then we discussed this important paradigm, and we discussed case of high altitude where the atmospheric oxygen pressure was going low, due to which the driving force reduced. And we discussed case of hypoventilation, COPD, and interstitial fibrosis, which were ultimately resulting in a lower arteriolar partial pressure of oxygen. Okay. The third thing was reduced oxygen carrying capacity of blood, which could be due to hemoglobin loss, or it could be due to hemoglobin dysfunction, right? Talking about hemoglobin loss, what comes to mind is anemia, in which the RBC mass goes down, but the partial pressure of oxygen in the arteriole remains normal, the saturation of oxygen remains normal. And talking about hemoglobin dysfunction, what we discussed is one is CO poisoning and the other one is methemoglobinemia, right? In methemoglobinemia, we had oxidant stress, while in CO poisoning, there was exposure to carbon monoxide, which is having more affinity to bind with hemoglobin as compared to oxygen. So this is what we have discussed till now. Now we will be discussing hypoxia, what exactly is happening here. In hypoxia, the oxygen delivery is low, right? Now, as the oxygen delivery is low, the oxidative phosphorylation will go down. oxidative phosphorylation will go down, right, which will reduce in reduced ATP, which will result in reduced ATP, sorry. So all those functions, all those vital functions which were going on in the cell, which were dependent on ATP, will be affected, right? Three main ones are, first is sodium potassium pump. So what does this pump do is, you know that ECF has more amount of sodium and ICF has more amount of potassium. Now this pump used ATP and it pumped 3 sodium outside the cell and 2 potassium inside the cell against their respective gradients, right? What happens is that if ATP is reduced, if ATP is not being formed in adequate amount, the sodium potassium pump activity will be affected, due to which you will see overall influx of sodium inside the cell, right, along the gradient. It may be due to leaky channels or other things. And we know that wherever sodium goes, it carries water along with it, right? So water too will enter inside the cell, and as water enters inside the cell, what you will see is that there is cellular swelling, right? The cell will start swelling up. Okay, so this is one thing. In fact, sodium potassium pumps, one of the most important role is to maintain the cell volume. Okay, now coming to the second one, calcium pump. So the function of calcium pump is to maintain a low cytosolic calcium level, right? But now as the ATP is not being formed in adequate amount, we will see that calcium pump won't function, due to which the cytosolic calcium will increase, and calcium is one of the important enzyme activator for many enzymes. So increased cytosolic calcium will ultimately lead to unnecessary enzyme activation, right? So this is how calcium pump will be affecting. And the third thing is your aerobic glycolysis will again go down, right? As the steps which will be requiring ATP, there are multiple steps in entire aerobic glycolysis where you see that ATP is being required, right? So there you will not be able to give the adequate amount of ATP, due to which your aerobic glycolysis will go down and further resulting in further lower amount of ATP, right? So this is how hypoxia affects the tissue where the oxygen delivery is low, right? Now coming to the phases of injury, there can be an initial phase which is the reversible phase, and if it progresses further, it can lead to a irreversible cell injury, right? So there are two kinds of cell injury, one is reversible, other is irreversible. Talking about the reversible cell injury, the hallmark which you need to remember is cellular swelling. It is cellular swelling, right? Now as the cell will swell, we saw what was the cause, right? The sodium potassium pump won't be functioning and it would be resulting in cellular swelling. Now imagine a puffer fish, right? You see it has some kind of spikes on its body, right? On its body surface. Let's imagine a puffer fish to be a cell and those spikes to be a microvilli. Now when the puffer fish puffs up, right, when it swells, what you see is that the microvilli, or basically those spicules, don't remain that prominent, right? They don't remain that prominent. So in the same way, what you will see here is, as cellular swelling takes place, you will see loss of microvilli. Right? Another thing what you will see is that the membrane may get overstretched and you may see membrane blebbing, right? It may get overstretched and you will see membrane blebbing. And the third thing is, basically what happens is that water is coming inside, right? The cell is swelling in entirety, so all the compartments present in the cell will swell, right? So RER also forms a different compartment, right? It doesn't, its lumen has a different compartment. The cytosol is present in another compartment, right? RER, the entire this membrane system present within the cell, basically compartmentalizes the cell. So RER will also swell. We will see swelling of RER. Now as RER swells, what you will see is that ribosomes pop off, right? Ribosomes pop off. Why is it so? because ribosomes are not covalently bonded to the RER. And as ribosome bound RER bound ribosomes reduce, what you will see is that protein synthesis will reduce. Okay. So, what all did we see in reversible cell injuries? The hallmark is cellular swelling, which led to loss of microvilli, which led to membrane blebbing, and it also led to swelling of RER, due to which the ribosomes popped off. And as RER bound ribosomes reduce, the protein synthesis will reduce. Okay. So, these were the general conceptual points in reversible cell injury. Now, coming to the final piece of discussion here. Eventually, if this progresses, if this persists, then this damage will become irreversible, resulting into irreversible cell injury. Right? It will result in irreversible cell injury. And what is the hallmark for irreversible cell injury? The hallmark is membrane damage. Right? Generalized membrane damage, right? The plasma membrane may get damaged, the organellar membrane may get damaged, right? So first of all, talking about the plasma membrane, whenever the plasma membrane gets damaged, what you see is that the intracellular enzymes leak out, right? And as they leak out, they can be seen in blood. And this is one of the most important diagnostic modality. You can see the case of MI and many other diseases. So it is one of the quite important diagnostic modalities present, where you see that the intracellular enzyme leaks out, and it can be seen in blood. Right. Other thing what you will see is that calcium rushes in, right? And as calcium will rush in, what can it do? It can cause unnecessary enzyme activation. Now, if lysosomal membrane gets damaged, then the lysosomal enzymes will be released in the cytosol, right? And as intracellular calcium has also increased, let me mention it here, intracellular calcium. As intracellular calcium has also increased, it might lead to activation of some of those lytic enzymes, which will lead ultimately to trashing of the cell, right? So this can be one thing happening there. Plasma membrane damages, intracellular calcium increases. Also intracellular enzymes leak out, which will lead to an important diagnostic modality where you can see these enzymes in the blood. And if the lysosomal membrane damages, then lytic enzymes trash out the cell. Lytic enzymes trash out the cell. Right? Now, coming to another important membrane damage which needs to be discussed here is mitochondrial membrane damage. Talking particularly if in mitochondrial membrane damage, the inner mitochondrial membrane, if it gets damaged, what you will see is that the major enzymes of the electron transport chain are present there, right? So, if inner membrane damages, then the ETC won't function, right? And in that case, even if oxygen is supplied, the damage can't be reversed, right? So this will be resulting in an irreversible injury. Okay. And the last point, if the mitochondrial membrane damages, what can happen is that the mitochondrial enzymes and other molecules present within the mitochondria will get leaked out into the cytosol. Out of those molecules, one is cytochrome C, right? Cytochrome C is one thing which, if leaks to cytosol, can activate apoptosis, which will ultimately result in cell death, right? So with this we conclude our discussion on cell injury, And what we majorly discussed is that what is cell injury. We discussed about the likelihood of injury depending on the severity, on the type of stress, on the type of cell, right? Then we discussed about common causes of injury, of which the main focus was hypoxia. Hypoxia was low oxygen delivery to the tissues, and we discussed that the major cause for cell injury is hypoxia. Now, talking about the causes of hypoxia, the major cause is ischemia. Apart from that, you can have hypoxemia, you can have reduced oxygen carrying capacity of blood, right? Then we discussed all these things in detail, right? Ischemia and hypoxemia and the reduced oxygen carrying capacity of blood. After that, we discussed how hypoxia affects and results into a cell injury, right? So ATP will not be formed and the vital functions will be affected. Then we discussed about reversible cell injury and irreversible cell injury, in which the reversible cell injury had a hallmark which was cellular swelling, while in case of irreversible cell injury, the hallmark was membrane damage, right? And then we discuss these in details, and with this we conclude this video. If this video helped you, don't forget to like, share and subscribe. This is Med Novice, learning medicine the simpler way. Thank you.